Hi, my name is Dr. John Hilinski. I am a double board certified facial plastic and reconstructive surgeon in private practice in San Diego, California. In today's rhinoplasty tutorial, we're discussing surgery for a common cosmetic abnormality termed a hanging columella. Let's start off by first clarifying the term columella. This refers to the soft tissue structure resembling a column that divides the nostrils into left and right sides. By virtue of its location, one can appreciate its critical role in supporting the nasal tip and nostrils. Consequently, it can be said that the columella contributes significantly to the overall shape of the lower one-third of the nose. Normally, the columella is seen on the front view as a slight downward curvature in the opposite direction of the nostril rims. This curvature should typically appear as a gentle changing contour across the bottom of the nose. On the side, or profile view, the columella is seen as the lowest border of the nose and helps transition the tip into the upper lip. The visible region between the lower margin of the nostril and the bottom of the columella corresponds to the inner lining of the nose, which is commonly referred to as columellar show. It should be pointed out this is a completely normal finding on side view of the nose, with 2 to 3 millimeters of columellar show considered within normal range. So what do we mean when we say a rhinoplasty patient has a hanging columella? A hanging columella refers to a variation in shape whereby the bottom of the nose appears to literally hang down below the rest of the nose. This is technically different from what some people call a drooping or ptotic tip, although both abnormalities can be seen simultaneously in some cases. So what accounts for a hanging columella? It is usually due to an excessively long septum, which is the wall that separates the right and left nasal passages. If the septum is too long, it will protrude forward in between the nostrils and push the columella downward. The end result is a nose that appears to have excess heaviness below the level of the nostrils. This is best appreciated on this frontal view of a rhinoplasty patient of mine from San Diego. As you can see, the outline of her columella is more than just a slight change in contour. Rather, her columella nearly points downward and gives the appearance of hanging below the nostril rims. On her side or profile view, one can appreciate a greater than average distance between the lower nostril rim and the edge of the columella. This contributes to the fact that the bottom of her nose appears to hang down too low. Worth noting, this patient also happens to have a slightly drooping tip and dorsal hump deformity as well. After thorough consultation with her, she decided to undergo an open rhinoplasty procedure to reshape her columella, tip, and bridge. We opted for an open approach as opposed to a closed approach because of the improved visualization and surgical access that this afforded us. This was particularly helpful when it came to addressing the hanging columella. By opening the nose from below, we were able to gain full access to her septum, which was notably long. Following separation of the tip cartilage, the septum was cut back to a more appropriate length. The tip was then reattached in a new position, effectively correcting the hanging columella. In this particular case, we also narrowed her tip and refined the bridge. The end result of her rhinoplasty is demonstrated here. On frontal view, there is no longer a hanging columella. She now has a gentler, softer curve in between the nostrils and a more feminine overall tip shape. On side view, she now has a more pleasing profile as a result of repositioning her columella with less unwanted columellar show. Overall, this rhinoplasty patient has undergone a beautiful natural transformation to her mid-face region with a more balanced nose that is now in better harmony with her remaining facial features. I hope this discussion on rhinoplasty for the hanging columella has been informative for you. Thank you.